Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. With the recent high-profile suicides of designer Kate Spade and celebrity chef and author Anthony Bourdain, there's a renewed fear of a suicide contagion. There have been studies that show when the news reports extensively on celebrity suicides, more people are at risk for committing suicide themselves. That's why we invited Kawana Ripoll to the show. She's the Behavioral Health Director of Daughters of Charity Health Centers, and she'll talk about suicide prevention. She'll tell us what signs and symptoms we should look out for in ourselves and others, and where to find mental health services in our area if you or someone you know is struggling with suicidal thoughts. Men are especially at risk because studies show they are less likely than women to get help for mental health issues. Last month, June, was Men's Health Month, and many of us got to celebrate Father's Day with our loved ones. But now, July is a great time to ask the men in your life to go see a doctor, because statistically, men just don't like to go. In our Community Health Heroes report, I talked to one doctor in Harvey who explains why it's important for men to get an annual exam and how men can channel their competitive spirit in a healthy way to enhance their well-being and quality of life. And in the kitchen for our Eat Fit NOLA cooking segment, there's lobster in the house. Executive Chef Marlon Alexander from Crew, a specialty seafood and cocktail bar located in the Pythian Market, will be here to prepare Lobster Ceviche. He'll also tell us all about the other Eat Fit approved menu items Crew offers, including shrimp cocktail, smoked trout dip, and tuna tartare. So don't go away. We'll be right back with more Community Health Heroes.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit.
Okay, I get it. I'll do better. Just please, don't leave.
Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back to Community Health Heroes. Did you know suicide is the 10th leading cause of death in the nation? According to the American Foundation for Suicide Prevention, more than 44,000 Americans commit suicide every year, and suicide costs the United States $69 billion annually. And now, with suicide in the news showing people who seem to have it all take their own lives, many who are struggling with suicidal thoughts are even more tempted to do the same. We're very fortunate to have Kawana Ripoll join us on the show. She's the Behavioral Health Director of Daughters of Charity Health Centers. Thank you for joining us today, Kawana.
Thank you for having me.
I'll tell you, with all the terrible news right now about suicides, I guess you can say one silver lining is at least people are talking more about mental health issues. So talking about suicide specifically, what are some of the signs? Like, how do you know someone's in trouble?
Well, you always know someone's in trouble, your loved one, a friend, anyone in your life. You will know that they're in trouble by their behavior. That's why we call it behavioral health, because The mind, the only way it can communicate with the body is through your behavior. So if you start to notice that your friend is withdrawing from society, withdrawing from you, or maybe sleeping too much, eating too much, not eating enough, sleeping too little, those are signs in which you need to say, hey, what's going on? How can I help you?
I also know another sign is when people start giving things away. That's such an interesting behavioral trait too, right?
Yes, because actually they're preparing. They're preparing for their death. So what they're trying to do is make amends with the people in their lives. Maybe a Tupperware dish that they've had for years, and then they say, hey, I won't need this anymore. Their favorites, maybe you gave them a sweater to borrow. They give it back to you saying, I don't need this anymore. Those are signs that you really need to look for. And I always tell people, if the hairs on the back of your neck stand up, get help.
But what happens if it's like you're suicidal? Do suicide people sense these symptoms in themselves, or do other people really have to say, hey, wait a minute, you're acting strangely?
Both, actually. I mean, sometimes they'll see it in themselves, that maybe they're not acting as normal as they used to in the past, or maybe their friend or family member will come up to them and say, something's not right. You're not acting like the Susan that we're used to. And it is at that time that your friend needs to say, you need to tell your friend, hey, what's going on? How can I help you? What kind of support do you need in this time of crisis?
Now, if you're just feeling blue or a little depressed, I mean, those symptoms are different than the type of feelings you would have if you're suicidal, right? So, I mean, you shouldn't freak out if you're feeling a little depressed at home one day, right?
No, we all have depressed symptoms. I mean, disappointments happen in life, right? You may not get the job that you want. Maybe you scored a low score on a test. I mean, we all have disappointment, and we all suffer from depression every now and then. I always tell people, when you're feeling that way, go to a close confidant, a loved one, maybe your pastor, or I always say, as a professional, seek help. Sometimes going to a counselor who you don't know, they don't have judgment, right? And it's confidential. So you'll be able to speak your mind, express your feelings in a safe environment.
Oh, that's really good advice. One thing we talk a lot about on the show are preventative measures for chronic illnesses. Are there any preventative measures you can take for suicide? Is there something you could do to kind of prevent getting to that dark place?
I always say exercise is the best thing.
Exercise, really?
Yes, exercise for depression is always the best thing, because it's our way of kind of getting those endorphins going, and you always feel better, even though you may not want to exercise in the beginning. You always feel better after. And I always say, talk to someone. Don't hold those feelings inside. Share your feelings so that maybe you can talk to your family member and they can get you help if you feel like you can't get it for yourself. And I always say also to know your crisis line. Know the crisis lines in your community. Metropolitan Human Service District has a crisis line. The Jefferson Parish Human Service Authority also have crisis lines. And we have the National Suicide Lifeline that you can always call.
How important is it to start taking care of your mental health? I mean, how you know from an early age you need to see a doctor like once a year. But in terms of mental health, how young do you have to be? How early do you start pursuing trying to make sure your mental health is perfect as your regular health?
Honestly, I would say go to your doctor. Go to your doctor. Right now there's a big initiative in healthcare called Integrated Behavioral Health. And that's primary care, and we integrate behavioral health care with it. And what happens is, in most federally qualified health centers, they screen you for depression, anxiety, those issues. And when it's flagged, guess what? You get referred to a behavioral health counselor or social worker who can help you out.
I wanted to ask one last question about suicide. If you feel you need help, I know there's a lot of resources in the area. You mentioned some crisis lines. Are there some other places or resources that you can direct our viewers to? Sure.
Daughters of Charity has a behavioral health department. It's available to our adult population who are receiving treatment with one of our primary care providers. However, if you are youth or an adolescent, you don't need to have a primary care provider with Daughters of Charity. Just call us and we can get you some help.
And tell us how our viewers can find out more about Daughters of Charity Health
Sure.
Centers.
You can go to our website, www.dcsno.org, or you can call 207-3060. That's our main line.
Great. Well, Kawana, thank you so much. I know our viewers will really think this information is very valuable, especially because of all that news out there. There's been such bad news every time you turn on the TV.
I know. But guess what? There's help out there. Don't suffer in silence.
Well, thank you again.
Thank you.
When we return, we'll talk about men going to the doctor, or more specifically, why we should make them go to the doctor at least once a year in our Community Health Heroes Report.
When I was 6, I had one thing on my mind. When I was 6, my days were spent playing basketball every chance I could. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke. I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Protect the ones you love. Spot a stroke. F-A-S-T. Fast.
Did you know, according to the Centers for Disease Control and Prevention, productivity losses related to men's health issues may cost U.S. employers more than $100 billion annually? If you've ever tried to get the man in your life to visit a doctor, you probably know it's a tough sell. I spoke to one doctor in Harvey who said men should think about their health like a competitive sport and schedule an annual wellness visit with their primary care physician to provide the opportunity to detect and take charge of any potential health issues or diseases early. How to do just that in this Community Health Heroes Report. Dr. Joshua Mizell, an internal medicine pediatrics doctor with the Family Doctors, the internal medical practice at West Jefferson Medical Center in Harvey, Louisiana, says it's a common diagnosis. Men don't like to go to the doctor. According to United Healthcare, only 76% of men have seen a doctor in the last year.
Sometimes just getting patients in the door can be the hardest part. I think that there probably are many men out there that are reluctant to go to the doctor, and sometimes maybe it's a sense of denial that if they don't go to the doctor, there can't be anything wrong with them. Men can get a lot of benefit from coming to primary care and attending regular visits and making sure that they're up to date on their preventative health.
According to United Healthcare, men have a shorter life expectancy. On average, men live to 76, women to 81. Men are more likely to be addicted to alcohol and tobacco and are 80% more likely to misuse drugs. Men are also at a 71% higher risk of being overweight. While men are encouraged to get regular checkups, 33% of men don't have a regular doctor, and 24% go a full year without seeing one. At the Family Doctors on Lapalco Boulevard, Dr. Mizell said a little prevention can go a long way.
Men are going to be higher risk for heart disease, especially at sometimes an earlier age. And so coming to primary care visits can help determine some risk factors early on that sometimes can be modified to try to prevent that long-term risk. So we can diagnose high cholesterol or high blood pressure and start addressing those things at an earlier age sometimes than men might delay, and that can try to prevent those long-term risks. Sometimes it can be medications that might help with those things, but sometimes it's things as simple as some lifestyle management, like exercising more and reducing sodium in the diet, or reducing cholesterol in the diet, and all of those can be helpful for mitigating those long-term risks.
Dr. Mizell says the best way to reduce the early onset of chronic illness is to go to the doctor regularly.
Even if you're not feeling bad, I think it's important to keep up with regular visits to the doctor, because there's lots of things that might show up on blood work or on, your blood pressure, vital signs in the room during the visit that might prompt further workup or further testing, even if you didn't feel bad. And so I think it's important for those regular visits, even when you're not feeling bad, but particularly if you are.
Another way to make going to the doctor more appealing for men is to turn personal health and wellness into a kind of a sport. Men can pair up with a workout partner, someone who can encourage them to achieve their wellness goals. Men can also see if their employer offers a wellness program that enables them to earn rewards for achieving certain fitness goals or offers discounts on gym memberships. To maintain overall health, it's important for men to compete with themselves.
Empowering the patient with data sometimes can be really helpful for that. So if they know what their numbers are and they can take ownership of them, then sometimes it's a competition within themselves. Like they want to make sure that next time they come in, their blood pressure readings look better than it did the time before, or that their cholesterol numbers look better than the time before. Even if it's not competing with someone else, just competing against their own numbers sometimes can be helpful. So I think giving the patients those tools and those numbers to know where they're at can be helpful with that.
But numbers on a chart don't always tell the whole story. According to the American Psychological Association, studies show that men are less likely than women to seek medical help, especially for depression and other mental health issues.
I would agree that probably it's true that men sometimes might be a little bit more reluctant on average to come and seek help for mental health problems than women. Sometimes the symptoms of depression might present a little bit differently in a man compared to a woman. On average also, men might be more likely to be more irritable or angry when they're depressed, more so than crying or sad all the time. And so sometimes sometimes maybe they wouldn't even recognize that what they're feeling is actually depression, so that can sometimes be a challenge. But I think it's really important for men to come in and talk about those sort of issues so that they can be addressed, because the mental health problems definitely play a role on their overall health as well.
If men feel uncomfortable talking about their feelings with someone in person, they can schedule a virtual visit with a mental health provider via a mobile device or computer. It's a service that can shorten wait times for an appointment, eliminate travel time, and expense.
I wish more of my patients were very proactive when they have problems going on, that they're very proactive about coming into the doctor and making sure that whatever their problem is addressed or explained, rather than maybe just brushing it under the rug and forgetting about it.
After 15 years of smoking, Eva Marie quit. There's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. Learn more at savedbythescan.org.
I'm Molly Kimball, registered dietitian and founder of Oxner's Eat Fit NOLA. We've collaborated with more than 100 partners locally to create Eat Fit NOLA, a partnership that highlights the better for you items right there on our restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit NOLA, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away, Community Health Heroes will be right back.
The Pythian Market is an urban food collective located in the historic Pythian Temple in New Orleans' Central Business District, and it just opened up in May. In it, you'll find 14 locally sourced purveyors, and one of them is Crew, that serves up specialty seafood and craft cocktails. Crew's executive chef, Marlon Alexander, is here. He's going to prepare some lobster ceviche for all of us, and Eat Fit NOLA ambassador Emily Eickoff will tell us about the nutritious benefits of the dish and Crew's other Eat Fit NOLA approved dishes. So great to have you both with us today.
Thank you so much.
Everyone in the studio is very excited about this dish. Tell us why lobster ceviche is the perfect thing to serve in the summer.
I think lobster ceviche with the melon, we have like a melon puree, so it's very refreshing. The lobster itself, cool. I mean, it's a perfect summer dish.
And how do you start preparing? Because it sounds a little complicated, is it? Or can you do this at home?
I think you can do this at home.
Okay, so show us where to start.
In short, this is the easiest way to do it. So everything is sort of pre-prepped. So you have the lobster, which is just lightly poached lobster. I'm going to put on my...
How much should you buy to prepare at home?
I would say if you do 2 lobster tails, you'll have enough for about 3-4 servings.
Gotcha.
Okay.
Oh,
so we're just going to put
nice and pink.
A little, yes, light poached, a very light poach. We'll put a little salt, a little pepper, right? A little salt, a little pepper, and lime juice.
Ooh.
Right?
You can smell it.
So some people like their ceviche just cooked or cooked by the lime juice, but we actually lightly poach ours. It all depends on, the individual. Now, the tricky part, the avocado.
Uh-oh. It's breaking out the avocado.
We love our avocados.
I love the healthy fat.
We love them.
Yes, Emily talks about avocados very fondly.
Yeah? Okay.
And Emily, while Chef Marlon is doing all this, tell us a little about lobster in general. Why is lobster such a good food for us to eat?
Yeah, I think lobster is a great summer food, or almost any time of year to enjoy. It's really rich in vitamins and minerals like vitamin B12, minerals like zinc and selenium and magnesium, things like that. But just an all-around great high protein ingredient in many different dishes. So.
Now, I know this is Eat Fit NOLA approved, so it can't be too fattening.
It's not. It's actually pretty low in calories. It's about 250 calories, but incredibly high in protein, about 20 grams of protein, and a good amount of fat, too, from your healthy avocados. So.
Gotcha. So you just scooped out some avocado and put it in that?
So scooped out the avocado, mash that just a little bit with cilantro, salt, pepper, a little bit of lime juice, and then all we're going to do next, so you have the avocado mousse on the bottom, and then you just take the lobster and you feed it through my little handy round here. I'm going to push that down.
Oh wow, look, you're squeezing it right down.
Right. I'm going to take just a little bit. This is there we go, the melon. And so that can easily go on the outside.
So taste-wise, it's going to be a really nice blended flavors, right?
Yeah, it's definitely a great summer, relaxing, cool dish.
Looks like there may be some cantaloupe involved
There's
in there.
cantaloupe, there's a little bit of agave, right?
Oh,
wow,
how
that's beautiful.
And then just a little bit of greens on the top.
Well, that took no time. I guess this is super easy to do at home.
It is
and it's so impressive looking.
Super easy to do this dish.
It belongs in a magazine, though. It really goes to show how
it's very easy to put together.
How great. Now, how many people does it serve with the recommended portion of the lobster that you said it serves 3?
So if you do, basically it's a half of a tail per person. So 2 lobster tails, you're going to feed 4 people.
Now, I do know Crew also specializes in craft cocktails. So is there something specifically you'd want to pair this with at home?
I am a fan of handcraft cocktails, and I love margaritas. So actually what I do, sometimes it depends if it's alcohol. You can put a little bit of this avocado. It has a avocado margarita spice to it. That's very lovely. So I love handcraft cocktails. I love, going to like very cool, intimate bars in town and just trying out different cocktails.
Now, I also know Crew specializes in seafood, and it's locally sourced, so you use a lot of local fishermen and fishmongers and oystermen and everything?
Exactly. Like one of my favorite dishes we have is the fried oyster, and that's a local Gulf oyster. So it's a truffle mayo, fried oyster, a little bit of the tuna tartare, and a black pepper caviar.
Emily, why is it so important for people to incorporate seafood in their diets all year round?
Yeah, seafood is a great option. It's very high in protein, lower in fat, and so when you're wanting that higher protein dish, not wanting to go for the red meat or pork or anything like that, fish is and seafood is a great option for that.
And Emily, tell us a little about your relationship with Crew, because I know it's pretty new, but you already have several Eat Fit NOLA approved dishes. So tell us a little about the relationship and what else the chef brought.
Yeah, so Crew is technically coming soon, but being printed on the menu probably as we speak. Right. And we do have a couple of other interested vendors at the Pythian Market, but Crew was kind of the first to be like, we want to be a part of this. So we're so excited about that. But they also have the tuna tartare, great option, very high in protein, almost 40 grams of protein in that. So gonna keep you full for a long time. And then that is the smoked trout dip, so another great option.
And Chef Marlon, you want to tell us real quick about how easy those are to prepare, or are those a little more complicated?
Well, I make this definitely a la menu, so made to order. So it's chives, there's a little bit of shallots, there's capers, a little bit of ponzu, and I love heat, so I put like a sambo sauce to go with that. And also,
that's a sauce right there?
That's all inside this, and that's an onion, like a fine herb that we have. But this is actually a little bit of a truffle mayo. light mail, that is.
And this lovely thing.
And so the smoked trout dip, obviously smoked trout, a little bit of a light mail, and it does have like chives and shallots.
Wow, they're both
and
beautiful.
dill.
And dill. I'll tell you, it smells wonderful. Tell us a little about the Pythian Market, because I'm sure a lot of our viewers haven't had a chance to go in yet. Why should they go and visit?
Well, you know, I think it's definitely a market for everyone. It has, I mean, every genre of food that I can think of is in this market. It has great history. Louis Armstrong performed there when he was, I believe, like 15 or something like that. So, I mean, it's just a very interesting place. The dance floor from this club from upstairs.
It's very historic.
Yeah, very historic. The dance floor is now like the tables. We reused all the wood. It's just, you know, it's a great place for the community to hang out.
And why was it important for you to reach out also to Eat Fit NOLA? You think it's really important to incorporate some of these guidelines into your menu?
Well, you know, I've learned a lot. I was a private chef for many years and worked at boutique hotels. So I was always about fit, getting healthy, and so, you know, using local farmers to bring in healthy greens at a, you know, a decent price. So, you know, you can come to Poulet and have rotisserie chicken. You can have that like in a wrap or a salad. So I'm all about bringing helpful to the city.
And I know that you don't actually have to always go to Crew just to get a la carte items, but you can do something special in advance too. I know you have special chef's menu events,
Right.
and that's
so
Tuesdays, Wednesdays, and Thursdays?
Yes, so you know, and it can be for 10 people, it can be for 2 people. So, and it's basically a chef's table, very intimate. You know, I'll be there to help and serve and you know, just educate you about the food and tell you interesting stories, I hope.
Gotcha. And just to finish up here, Chef, tell us a little about how our viewers can learn more about Crew. What's your website?
That is Crew NOLA, and Crew is spelled C-R-U. And you know, please, there's tons of information, and it's very interactive, so yeah, please come on down.
And Emily, before we talk about how our viewers can learn more about Eat Fit NOLA, I know you have a special event coming out. Do you want to tell us about that?
Yes, we're so excited. Our annual Eat Fit Dine Out Day is coming up August 22nd next month, and we'd love to invite all of your viewers to come and dine at our Eat Fit restaurants, and that goes back to Eat Fit to benefit us. So
and
really
where can they find out information about that? What's your website?
Yeah, eatfitnola.com.
And you also have a handy-dandy app, right?
We do have our Eat Fit app, and those restaurants will be listed on there as we kind of narrow it down from here.
Great.
So,
well, this was such an impressive demonstration. This looks fantastic, and it's amazing how easy that was. I mean, like, you're right, this looks like it belongs in a magazine cover. It's beautiful.
Well,
thank you both so much for joining us, and we'll be featuring your recipe on our website at communityhealthheroes.org.
Thank you very much.
Thank you.
Pleasure to be here.
We'll be right back.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurants, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we provided you about suicide prevention and local mental health resources and services, why you should ask the men in your life to go see a doctor and schedule annual visits, and how to prepare lobster ceviche for a delectable summertime treat will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.